So today we're going to go over a secondary line for IV. The first thing you need to do is check the chart or the CAL or the computer for the doctor's order. He has ordered ciprofloxacin for a patient.
Come on. Let's go check
It is for 200 milligrams and 100 mLs. So you go ahead and select your medication and you make sure that it's the right dose. 200 milligrams and 100 mLs, ciprofloxacin. So we have our medication. You go ahead and grab your secondary tubing. You go ahead and grab your two gloves and your label for the secondary line. And you can come over here into the patient's room. On the way in, go ahead and hand hygiene and introduce yourself to the patient. Hello, my name is Jay. I'm going to be your nurse today. The doctor has ordered some antibiotics for you, so we will go ahead and hang that. But before we start, can I get your name and date of birth? And we have Waters Kent, 4774, and we would confirm that we have the right patient. And at this time, we would also ask about allergies. Mr. Waters, do you have any allergies, especially to antibiotics? No allergies? Okay, great. So now that we've done that, we could take a moment to inspect the IV site. We want to make sure that there's no inflammation, infection, infiltration. You can even palpate just around the IV site and ask them if there's any tenderness. Is this tender at all, Mr. Waters? No? Okay. So we know that the IV is still good because we currently have some solution running through it, so it is patent. And we can go ahead and slip on our gloves. While you're getting your line ready, this would be a good time to explain to the patient about the side effects related to the drug. So, Mr. Waters, the doctor, like I said, has ordered an antibiotic for you. This antibiotic does have some side effects, some GI problems, some nausea, vomiting, diarrhea. Those are all more common side effects. Less common side effects, you could have some photosensitivity, so you'll want to stay out of the sun if you can, wear protective clothing, and tendon rupture is also a possibility, so just make sure you're not overexerting yourself, okay? You can then go ahead and open up your tubing for your secondary line. Now, to prime your tubing for the secondary line, you have to use your primary fluid so you don't waste any of your medication. Before we do that though, you can go ahead and drop your solution or else your piggyback won't work. So you need to lower your primary. Now, once you lower the primary, you can go ahead and start to prime your tubing. For this, you're going to come above the chamber here to this wide port, and you are going to go ahead and connect your tubing, and you're going to go ahead and unclamp and allow this to fill up with water. Go. And it starts to fill up, and you can go ahead and clamp it off once you get about halfway. And now you can go ahead and grab your medicine and spike your bag. Once it's spiked, you can go ahead and hang it, but before you start any of your infusion, you do need to double check in the IV book to make sure that the rate of infusion and medication is appropriate for the patient. So we can come over here to the IV book and we can look up and make sure. So we have ciprofloxacin here. The parameters, the range from 200 to 400 is appropriate according to the following chart. We do have a order for 200, so we do fall within that range. And then you come over to rate of administration. A single dose must be equally distributed over 60 minutes as an infusion. So now that we have those parameters, we can go ahead and use our pump and set it up. So you're going to come over here to channel select and press that button. You're going to select secondary. Now you have your rate, and judging from the book and everything, we do want 100 mLs to be infused in that hour. So we have that 100, and then the volume obviously is also 100, so we need all of it to be infused. All right, and then you can hit start, and you're going to want to make sure that this is unclamped, and you're going to wait for the drop. I'm going to wait for another one just to make sure. All right, and there we have our second one. But we do have some air in the line, so we do need to check this out and make sure that there's no problems. All right, now you do want to trace it all the way back up. Make sure there's no kinks or anything. All right, I don't see any kinks. There's no bubbles in the chamber, so we're gonna go ahead, clamp that down, and then hit restart and see what happens. We did have another drop in the chamber, and there is some more air in the line. So looks like we almost fixed the problem. So I don't know. You want to go ahead and hit, just, I don't know, it's like crazy bubbly. I don't know what happened.
It's reused.
That is probably it. It is reused. Is it still recording? All right, so ideally you would have new tubing and you wouldn't have to reuse it. But you want to make sure that this is completely primed, that there's no bubbles in it. If this did continue to happen, you could just always restart, grab new tubing, grab new medication, and make sure that it's infusing properly, that there's no air in the line. If you were able to resolve the air in the line problem, you could move on to labeling your tubing. So you can come on over here and grab your tubing label, place it on your tubing, give it a date, time, and initial. There is also labeling that goes on the medication. That is a patient label that you place there. And then again, before you leave, you make sure everything's working properly, the patient's not in any pain, and everything is running smoothly. On the way out, you're gonna hand hygiene and document the fluid you hang and how the patient tolerated the procedure.